Welcome. Thank you for joining our amazing team of students at Assuaged. Today, we will be covering COVID and whether or not a vaccination is the way to go. Today on the panel, we have Annette Castillo, Kimberly Monahan, Dean Bravo, Rikika Anand, and Nancy Davidson. So let's go on to the next slide. Go ahead, Nancy, it's all yours.
All right, so COVID-19 vaccinations. This is the first slide. Okay, so key points on vaccine safety from CDC. Millions of people in the United States and around the world have received COVID-19 vaccines. These vaccines have undergone the most intensive safety monitoring in U.S. history. The United States is using established and new safety monitoring safe systems to make sure the COVID-19 vaccines are safe. Results from U.S. and global monitoring efforts are reassuring. No unexpected patterns of reactions or other safety concerns have been identified during early vaccine safety monitoring. And if they show up, we have symptoms in place to quickly identify them and take action. Basically, I think that CDC did a great job on monitoring their vaccines and making sure that there's no allergic reactions or any other type of symptoms that people may face. So they've went through like certain guidelines to reassure that it's safe before they let it off to the public. Also, the Advisory Committee of Immunization Practice received all safety data before recommending the current COVID-19 vaccines for use. Sorry.
Did you want to go on and say something? Sorry.
Oh, no, that's it.
All right, so the vaccine and their effectiveness. So according to the CDC, the best COVID-19 vaccine is the first one that's available to you. So currently there are 3 different vaccines in the United States being offered, and it's the Pfizer, Moderna, Johnson & Johnson, and so the CDC does not recommend one vaccine over the other, and they state that all vaccines are safe, effective, and reduce your risk of developing a severe illness due to COVID-19. So here's some vaccine details. So for Pfizer, anyone 12 years or older can get the shot, and you would need 2 shots, and they're given 21 days apart, and you're considered fully vaccinated 2 weeks after your shot. So for Moderna, people 18 years and older are eligible to get the vaccine. And again, there's 2 shots that are needed, but for this one, it's 28 days apart. And again, you're fully vaccinated 2 weeks after the shot. And for Johnson & Johnson, it's people over 18, and this one's only 1 shot. So the safety of the COVID-19 vaccine. So the clinical trial data for Pfizer and Moderna vaccines show that when both shots of the dual injection immunizations are taken 3 weeks to a month apart, they're about 95% effective at least preventing severe illness. So some of the safety details of the vaccine continued. So for clinical trials regarding the Johnson & Johnson vaccine, it was reported that it was 66.3% effective in preventing COVID-19 2 weeks after vaccination. However, Johnson & Johnson was 100% effective in reducing hospitalizations and deaths from COVID-19. On April 13, 2021, the FDA recommended an immediate pause on the Johnson & Johnson vaccine due to 6 reported cases of women developing severe blood clots known as thrombosis. So distribution of the vaccine continued 11 days after the halt, and since then there's been 28 confirmed cases of these blood clots after receiving the Johnson & Johnson vaccine, though it's important to remember that correlation isn't always causation. And here are just some side effects of the vaccine. So some immediate effects that may be seen, maybe on the arm of the injection shot, where the shot's injected. And the side effects might include redness, pain, or swelling. And one may also experience tiredness, headache, fever, chills, muscle aches, or nausea.
So now we go on to discussing the vaccination rates in the United States with the states involved. We find that nearly 50% of all Americans have received at least one dose of the COVID-19 vaccination. And here's the chart that reflects the people that are getting it. Per location, New York has 43.4% of the population vaccinated, California 39.3%, Texas 33.1%, Florida 36.2%. Pennsylvania, 40.1. My home state, Illinois, has 37.1. I actually thought it was higher than that. And yeah, I worked the vaccine rollout. New Jersey, 45.2, and Georgia at 29%. So that's where we're at right now for the country, for the biggest, some of the biggest states there.
Okay. So what's there about that making people hesitant about taking the vaccine? So according to the Centers of Disease Control and Prevention, roughly 30 million Americans, that is 13%, are hesitant about receiving the COVID-19 vaccination. And what are the reasons why they are saying they didn't want the vaccine? That is that because they think that these vaccines can cause long-term side effects, and they don't trust the government or the medicine system, and they're waiting for more research. Actually, when the vaccination started, even we were all very apprehensive, and we thought, okay, let's see, everyone will get it, like a number of population will get it, and then only we can decide if we should go ahead with that or not. That was, I think, that apprehension was with everyone. But now we are more sure about it, and we actually got it. Now, believe that diet and overall wellness is enough to protect oneself from the virus, and that is the biggest myth. I believe that. Next slide, please. Okay, so number of doses of each vaccine. The Pfizer BioNTech COVID-19 vaccine and Moderna COVID-19 vaccine both need 2 shots in order to get the most protection. Definitely, after you get both the shots, you're 95% safe. Here I just want to add that the Johnson and Johnson, the thing is that once you take the shot, after 2 weeks, you're around 66% immune to the COVID. But as the time passes by, like after 28 days, you're almost 85 to 88%. You're better there. People should get their second shot even if they have side effects after the first shot, unless a vaccination provider or doctor has advised them not to get it. Definitely, if you're getting any side effects that are life-threatening, you should not go ahead with the second one. Only 1 shot of Janssen COVID-19 vaccine is needed to get the most protection. The main thing is that the Johnson medication, the vaccine has been tested later on, like in the later months, uh, from January to February, where we had the newer strains, and it was also tested outside of America, not only in America, like in Brazil and in South Africa. So I believed it was better until we got those news that people are getting thrombosis. But still, I got the Johnson. I'm good now. If 2 shots are required, the shots are given several weeks apart, and both shots are generally needed to provide the best protection against COVID-19. Patients should be advised to set up an appointment for their second dose before they leave. Okay. Okay. So as of February 27, 2021, 2 new vaccines have entered phase 3 of clinical trial: AstraZeneca COVID vaccine and Novavax COVID vaccine. So now this is the time for discussion.
Yes, it is a time for discussion. Forgive my pause there. We'll now be starting a discussion based off of today's topic. We encourage you to participate in this discussion by sharing your thoughts and ideas. We will be reading viewers' comments, and our team of students will be discussing these responses as well as adding our thoughts. So please proceed with questioning.
So discussion question number 1, do people need vaccination if they were COVID positive before or if they're positive now? So we don't know for sure how long exposure to the virus protects you from reinfection. Protection probably lasts at least a few months. We definitely know that the antibodies are in your system for at least 3 months. But public health experts say it's a good idea to get vaccinated when your turn comes up, especially if it's been many months since you were tested positive. And this is really because they're not exactly sure how long you carry the antibodies once you are infected with COVID. And there's no way to test. And they're also unsure as to what levels actually offer protection. There's some talk about health officials pushing those who have been infected in the last 90 days or so toward the back of the line to ensure adequate supply for those who might be at risk. This is one reason I actually came down with COVID, and I did wait the 90 days so the people who really needed the vaccine could be vaccinated, because I'm a nurse and I was at the front of the line, but I knew I had the antibodies, and so I waited. I went to the back of the line for the 90 days. I'm not sure if that's an issue so much anymore, because now, because of the vaccine hesitancy, the lines are not as long. It's a little easier to get your vaccine. So what is the purpose of the vaccination is discussion number 2. I think the biggest thing, and if anyone wants to weigh in on this, is you hear that term herd immunity. So the estimated amount of people for us to receive herd immunity is about 70% of the American population to receive the vaccine. That will create herd immunity and protect us from the spread of COVID. Right now, as you saw in an earlier slide, at least 50% of the population has at least one vaccine. Now, with the Johnson & Johnson, that works, but with the Pfizer and the Moderna one, you need to have both vaccines, and you're not fully immune until 2 weeks after you've received both of those vaccines. But the purpose overall is to get that herd immunity to prevent the spread of the disease. Does anyone want to add to that?
Annette, I'll just add to that is you're absolutely correct with the herd immunity numbers that you're saying. And I think Illinois is falling way behind on that. We're probably only about halfway, so we need to really step it up here. The other thing is there's been theories by certain countries and certain presidents and certain administrations that herd immunity can be created by people just getting sick and developing antibodies and then kind of blending it in without vaccination. That's my MPH studies. That's totally inaccurate. It's impossible. You'll kill off half your people, so it's just wrong.
Yeah, I was just looking at my county numbers because I live in Orange County, and there's a little bit of vaccine hesitancy here. I think more about the mistrust, and they feel like, oh, I've already had it, I don't need it. But I was surprised. We're at 38%, which is low. That's lower than New York and some of those numbers we were looking at earlier. But I was surprised it was as high as it was, really. And I talked to a lot of people in my area, and they're just not signing up quite yet. So it's a little discouraging.
Yeah.
I would say, getting into the purpose of the vaccination, there are people that are going to work every day, so they don't have the luxuries of working remotely. A lot of companies are starting to offer more remote work, so the susceptibility of getting COVID can be reduced. And, I just personally would prefer remote working just in general. I mean, it gives you more time at home and gets you more into that technology. But although I personally have not had the vaccination, I do think that it serves a strong purpose for those going out in the general public and working with other people.
Yeah, here I just want to add that like having a vaccine definitely makes you better at immunity, because my Back in India, my parents got first shot of their vaccine, but even after that, after 1 month, they fell sick. They got COVID positive, but they were doing better, and they managed to get recover at home only. But my sister, she couldn't get the vaccine because she didn't fall in that age category that time, and she was very sick, and she was hospitalized for almost 1 week. She came back last night only, and it was a nightmare for me because sitting here so far away from them, it was so difficult. So I will definitely suggest that she was like 30-35 years younger than them, my parents, but still the way it crushed her, it was so difficult. Even now she is not able to stand for more than 2 or 3 minutes. So I'll advise everyone to get vaccination as soon as they get as soon as possible for them. Thank you.
So I think for me, my only concern is that you guys all had great points. But my concern would be that people will use the vaccine as a way to just prevent sickness and rely on it very heavily without actually also looking at the other aspects of health, like taking good care of themselves, washing their hands, eating right, exercising. So the vaccine does serve an incredible purpose, but I definitely don't want people to negate the other healthy aspects of life and living just because we were lucky enough to develop one.
I agree with Amaya's point. It's people are just going to rely on it and think that once we have our vaccine, like we're totally immune to COVID, which is not true. It protects you for a small percentage, but you still have to carry on and take the proper precautions. So yeah.
Yeah, I think that's a good point. Vaccines are not 100%. Not any type of vaccine is 100%. And just, noted with the Johnson & Johnson, it's only 66% effective in preventing getting COVID, although it's 100% in putting you in the hospital or death. I think that sometimes people get confused with that. They think, I'm not going to get COVID because I have the Johnson & Johnson vaccine, and it is possible still. And there are mild symptoms, like just the simple thing of losing your taste and smell. And there are people who still haven't gotten that back. And, they had it back in July, and they're still struggling with getting their taste and smell back. So that's a long-term kind of severe consequence from COVID. So I hope people understand that when they're looking at effectiveness.
So now we go on to discussion question 3. What are the side effects? The side effects observed in trial participants were common to other vaccines: pain at the injection site, fatigue, headache, muscle pain, and chills. Those are minor side effects, and the benefit is not dying from this disease, says Dr. George Rutherford, who is a professor of epidemiology at the University of California, San Francisco.
So, side effects. I would not know that since I have not had the shot, but Ruchika, I would love for you to weigh on that one.
Yeah, when I got the shot, I definitely experienced all of this, and I was down for 1 day. But actually, after a few days, also that there were some lingering effects. I was feeling little bit lethargic and a little bit tired. But it's fine. Even if I'm like even if it gives me 50% immunity, I'm happy to have my shot. Because I'm still maintaining all the protocols, and I'm still not meeting so many people around there, and maintaining all the hygiene things, and going on for walk every day, 5,000 steps at least. So I'm trying to be healthy that way also. And but having a shot makes me like that gives me comfort of mind that yeah, I'm safer. Even if I get exposed to COVID, I won't die. So that's my main thing. Yeah. Thank you.
So I guess there's also that other aspect of the vaccine, not that it's not tested, but we just don't know any long-term effects yet, just because it is so new. We can't track what is going to happen in about 10 to 20 years. So there could be, more side effects come, just given time that has passed, or there could be nothing really major, kind of like how and the other vaccines. So that is, for me, definitely something that I consider very heavily, because hasn't been long-term tested yet. So yeah, there's that as well.
Another thing we have to consider is that, like if you took the Moderna or any of the ones that require 2, or the Johnson Johnson, they pretty much expire after like 205 days. So technically, we all should be getting a 3rd shot, and there's been no announcements on the rollout of the 3rd shot because not everyone's even got the 2nd one yet, or at least to get the first Johnson & Johnson, the only one. So there's more work to be done here. So by the end of the year, a lot of us are going to have to go back for another shot, and that's something we have to remember.
Yeah, they had, I was listening to Dr. Fauci this morning on the news, and he was talking about the booster. And they still don't have a date or time. People keep saying, oh, we're going to have to get a booster in 6 months. And but he was saying that's not true. We really don't know yet when and if. I mean, he is pretty sure there'll probably be a booster, but he doesn't know when. It could be a year or so until that booster comes along. And to Anya's point, I think it's great that you point out it is so new. I mean, normally it takes 10 to 15 years to get a vaccine through to be approved. And we've, pushed this one through in a year. So we don't really know the long-term effects. So that's a very good point.
Thank you. Cynthia, next slide, or should we entertain any more questions? Okay. Discussion question 4. So why do we have a waiting period of 15 to 30 minutes after vaccination? The Centers for Disease Control and Prevention reported 6 cases of anaphylactic allergic reaction in the first 272,000 people who got the Pfizer vaccine outside the clinical trials. This has led the CDC to recommend that people receiving the vaccine be observed for up to 30 minutes afterward. And basically, they have you sit down, and somebody, there's usually a paramedic or somebody of medical personnel kind of around in case you do fall off your chair or you're not feeling well. You can call out to them if you're not feeling well. I've saw this myself. It's pretty interesting.
I think that if you're going to go ahead and get the vaccine, I'm sure for those people and many more that there was no real indication that they knew that they were going to be allergic to it or go into anaphylactic shock. So I think it's really smart that they do that 15 to 30 minutes, just because, you don't really know until, you know. So that way, people are being monitored just to be safe. And if anything happens, people are prepared to step in and treat you for whatever allergic reaction that you're experiencing.
I think that's a pretty standard wait time after you get any type of vaccine. They make you wait 15 minutes or if you get your blood drawn. So I think that's pretty standard. But if you're like my husband, he went and got the vaccine and he was in the waiting room and he said he started to feel muscle pain in that 15 minutes. And I'm like, that's not possible. He's like already had it in his mind that he was going to have all these side effects. So it was pretty funny when he walked out. I said, it's not possible that you're going to have those kind of side effects in 15 minutes. They're just watching you for an allergic reaction.
Yeah, for me also, when I got the shot, they asked me to sit there for I think 20 minutes, and the nurse, she suddenly came and she said, why are you standing? You need to sit down because someone fainted half an hour back. So I was a little bit scared after hearing that, but it's fine. Like, I sat there for a few minutes and then I came back home and I was fine throughout the day. It was only after 12 hours that I started getting those symptoms, fever and fatigue. But it was only me in my house. My husband didn't experience any of those symptoms, and he was totally fine. He was carrying out his activities as normal. So it was only me who got affected. So it's not everyone get those symptoms also. That's another thing, right? Okay.
Discussion question 5. Are COVID vaccines interchangeable? So what this means is if someone were to get the Pfizer vaccine, would they be able to then get like the Moderna vaccine? And the answer is no, this isn't what you should do. You should stick with the same vaccine that you got from the beginning and for the second shot.
That's a great point. I'm really glad you brought that up because I actually didn't really even know the answer to that. I could assume, just like with medications, you can't really just switch out and take from here and there, but I was not sure. So I think that's a really good point to bring up. Thank you so much.
Yes, for sure.
Yeah, Kimberly, thanks for answering that question. I wasn't sure of the answer of that question. So thank you.
No problem. So is any vaccine recommended over the other? And no, the CDC does not recommend one vaccine over the other. Physicians are advised to tell their patient that they should receive the first vaccine that's available to them.
That's a really good point because some people really want to know which one is better because since Pfizer has better results than like Johnson and Johnson or other ones, like they want to hear it from like their physicians to tell them. But I think it's wrong to recommend one over the other since they're all tested.
For sure. One thing about this is I really wonder if in the future if like maybe we will know if the one has been more effective than the other. That's kind of one thing that's been weighing on my mind before getting it, kind of thinking like, oh, should I wait for a little more, see which one's most effective? That's been weighing on my mind about this vaccine. So yeah, well, who knows what the future holds with all this stuff. Hopefully
Yeah.
it just gets better and better.
Yeah, here I just want to add that I'm sure you guys must be knowing about this that Pfizer and the Moderna are using the new technology that is using the mRNA technology, while the Johnson Johnson one is using the older technology, which I believe is much safer because we have been vaccinated when we were kids, and that was my reason for taking J&J vaccine, and the other reason was that it has been tested on new variants. So that's my point. Yeah.
And I have heard, and this is just anecdotally, I hear people wanting to choose a certain kind because they've heard one has less side effects than the other. Like, oh, I don't want to get the Pfizer one because my friend, felt so sick after it, so I'm going to go for the Moderna one. So sometimes people are basing their decisions on the side effects, which is not accurate. Every body is different. Like, Ruchka, you were saying that you had a reaction to it, but no one else in your family did. So
Yeah.
It's really for your body. It's not really vaccine specific.
Okay. Yeah.
Now, I've heard Thane's mother is a nurse, and so she went for the Moderna one, and I believe because as what Ruchika was saying, it just had the newer technology, and and I've heard the same thing. I've heard people be affected by the shot, not affected. I really think it's just what shape your body is in. If you are someone that commonly gets sick, you're probably going to get hit a little bit harder. And for those reasons and the reasons of having my disability, I've quarantined myself more than just going out and socializing until things are safe and I can make a proper decision if the shot will be right for me. So it's all about doing the same for yourself too. So that's all I wanted to add.
Okay, so why do we need two doses? The first shot primes the immune system, helping it recognize the virus, and the second shot strengthens the immune system. So, with the two shots, we are like, as they are saying, 95% immune to the disease. And so, it's good to get the two shots. And I'm hoping that the J&J will come with the second shot by the year end. That's what I've been hearing, although I'm not sure about it. And secondly, what I've heard is that the COVID vaccine, this thing is going to be added along with your flu shot, which we get yearly, on yearly basis. And I never used to take flu shots because I believed that it reduces my immunity. But with COVID, I don't want to take any risk. Yeah. So, anyone else wants to share their ideas?
When looking at the percentages of coverage for effectiveness, the flu shot only offers about 40 to 60%. They're 40 to 60% effective. And so when you're looking at the numbers for COVID, this vaccine is quite effective, 95, 66. So it's higher actually than the flu shot, which is kind of exciting. So if they combine the two, if they offer both of them in one shot, that I think we would have more people getting the vaccine. So that would be great.
Okay, so it is our responsibility to get vaccinated because definitely we are responsible for our health. Then vaccines have helped conquer many diseases, and COVID vaccine has helped reduce the infection rate and deaths. Let's support vaccination. And this has been proven, like the case of India, if you observe it right now, nothing can support this thing any more than that, because we have seen that in US most of the population have got vaccinations and they are much safer. But in India right now, what the condition is that people who were above 50, they got the vaccination, and below 50, now the population which is suffering is below 50. When my sister was admitted, she told me that on the entire floor there are mostly people who are ranging from the age group 25 to 40. So definitely vaccination plays a very important role, and my recommendation is that if your physician says that you're good to go with it, please get it and be safe. Thank you.
Awesome. Thank you guys so much for tuning in and joining our Assuaged team. We really enjoy doing these discussions and just enlightening our audience on different concepts and better ways of living. So, as we master the craft of doing this, we do it twice a week. So, please join us on our Assuaged app channel. At Assuaged app is our social media handles, and you'll see it on the screen here as well. And thank you, all of you, for providing such insightful, amazing discussion today. Just you rocked it. Thank you. All right, we'll see you guys next week. Enjoy the weekend.
Thank you. Bye bye.
Thank